Hi, today we will continue about the congenital deformities in orthopedics. This is a crash course, so I will be touching upon each of the things which are mainly main questions and short notes. So for the UG, the important main questions will be a clubfoot, also called CTEV, and the second one is developmental dislocation of the hip, and the third one is scoliosis. A scoliosis could be a short notes or it could be a main question as well. The short notes could be cleidocranial dysostosis, amelia, hemimelia. So coming to the main questions, CTEV and congenital dislocation of the hip can be main questions. If you are able to collect and write at least 10 solid points, the examiner will give you at least passing marks. If you are writing diagrams, flow charts, covering all the things like introduction, types, clinical features, and then what are the special tests and how to assess treatment, complication, everything, you will get the full marks. So as I have told, like introduction and other things, you have to revise and keep in your mind all these topics related to the particular things so that you will be able to produce in the exam. Coming to the congenital talipes equinovarus, also called in colloquial term clubfoot. The clubfoot has got a broad spectrum of umbrella which also include other deformities and related etiologies. Coming to CTEV, its introduction is congenital talipes equinovarus. Congenital term indicates it has started before the birth. Talipes indicates foot. Equinus is nothing but the horse, the plantar flex foot which resembles the horse foot. Varus has got an inversion and adduction which is in the mid-tarsal and talar and subtalar joints. Coming to, so this is the introduction and the definition. As such, there is no particular definition. And coming to the types. In the types, the CTEV per se is a primary. The other clubfoot which includes other reasons for it could be secondary. The primary is present since birth and it is idiopathic. The secondary could be associated with various syndromes, could be associated with various muscle and bone anomalies. Coming to the why we have to classify these things is to understand and treat. If it is associated with other syndromes, the other things also has to be treated. Coming to the etiology, various theories has been put forward to know what might be the cause of CTEV. So the main theories which have put forward is mechanical theory. In mechanical theory, they say that it is due to the pressure in the intrauterine cavity. For example, it could be oligohydramnios in which the intrauterine fluid is less, or it could be poly or multiple pregnancies like twins in which the space in the uterus is very small to accommodate the two fetuses. So the space is less, due to compression the foot has become CTEV, clubfoot like. Other causes could be a genetic cause. So I have told you mechanical causes, I have told you genetic causes, or it could be ischemia. They say that it could be an ischemia of the muscles, nerves and tendons in the foot which is the reason for the contraction of particular group of muscles to make the foot deformed. Coming to the clinical features, how does the child presents to you? The child presents to you, either it could be seen at the time of delivery by the obstetrician, or it could be assessed by the pediatrician who is attending the delivery, or it could be seen or brought at the infancy by the mother or grandmother. In the late period, usually in India, some of the times the female at the time of maturity or nearing the maturity, the parents are thinking of her to get married. So it could be a cosmetic problem for the parents, for which the child, the girl is brought to the orthopedic